tumor cryoablation is emerging as an attractive, minimally invasive alternative to surgery for breast cancer. Compared to open surgery to remove breast cancer tumors, cryoablation requires minimal time for both the doctor and the patient. It does not require general anesthesia, and usually the patient can go home the same day. However, cryoablation does have some limitations with the way the procedure is currently done. The success of the procedure is based on the precision of cryoablation probe placement and also on the relative size of the ice ball and position of the ice ball produced by the cryoablation with regards to the position of the tumor. If any of the tumor is missed by the ice ball, the remnants of the cancer can reform, which would necessitate further operation in the future or an open surgery. So we're hoping to improve this navigation of the cryoablation probe using augmented reality. So the objective of this project was to use motion tracking, sensor fusion, augmented reality in the form of the HoloLens goggles, and fuse all of that with preoperative imaging to produce a real-time navigation system for cryoablation. The system we used, it uses, like I said, the Microsoft HoloLens augmented reality system. We're using a magnetic tracking system called the Aurora, made by Northern Digital Inc. We're using augmented reality image targets for registering preoperative MRI or CT imaging that's been previously segmented. We're using a breast fixturing system to make sure that the breast is in the same position when the preoperative imaging is taken as the position it will be in during the operation. For prototyping, we used a breast phantom, obviously, because there's no way to test this on a patient, and a cadaver study wasn't possible at this time. So below our materials and equipment section, you can see our system design. Basically, the computer does all of the work of all the math, taking the numbers in from the magnetic tracking system to figure out where the probe is in space. And the computer also aligns the preoperative imaging with the position of the actual patient, or in this case, the breast phantom, as seen by the magnetic tracking system. So that way everything lines up. You can see in the picture on the right, we've got some holograms displayed. Well, it's a screenshot of holograms displayed in the augmented reality system of the internal breast anatomy and the tumor position, and that's overlaid on top of the actual breast phantom. And then the wearer of the HoloLens gets an X-ray view, essentially. So they see exactly where the tip of the cryoablation probe is when inserted inside of the breast, and they can effectively navigate to put the tip of the probe exactly in the center of the tumor. So finally, we have a working prototype here, but some future work includes simulation of ice ball size so that we can make sure that the operator knows exactly how big the ice ball has gotten and that it's ablated the tumor, and of course moving into a cadaver study to figure out how well the system works outside of a phantom.